Right, so catheter-related bloodstream infections are one of the more prevalent complications that we have post-operatively. It affects a lot of people. It affects 250,000 people nationwide per year, and it costs hospitals $3 billion nationwide, and that's a huge problem. And we want to try to reduce that incidence of these infections. So we invented a device that increases the ease of which we can disinfect these IV injection ports, as you can see right here. So they're injection ports that are on the sides of these IV tubes, and before you get an injection, standard protocol is to swab it with an alcohol swab. And it's pretty simple to use, but when you're doing dozens of these injections at a time, it gets to be a pretty big hassle. So our device sits directly on the port itself, so you can just dispense these strips over the port themselves. And if you want to talk about how...
So ultimately the goal of our device is to increase compliance and make it easier for doctors and nurses to do these disinfections. Because right now, even though alcohol swabs are cheap and fairly easy to use, disinfection only occurs properly about 40% of the time. So over half the time you're getting an injection, you're not getting cleaned properly. And so our device has two components to it. One is a plastic housing that actually clips directly onto the port, which puts the swabs right at the site and makes it a lot easier for doctors and nurses. You don't have to go find alcohol swabs, unwrap them, and then come back to the port to do your disinfection. The other component is the strips themselves. The way we designed our strips is it's actually a strip very similar to bubble wrap, and each one contains a little bit of alcohol, the same liquid that's inside the alcohol swabs, and the other side is dry white material. And so when you want to do disinfection, you simply pull out a strip, put the bubble over the port, and you burst it. It saturates the wipe, and then you just clean just as you would with an alcohol swab. And so it makes the process a lot simpler and easier. And one of the big motivations for this project is Medicare and Medicaid no longer reimburse hospital-acquired catheter-related bloodstream infections. So if someone gets an infection and the hospital is accountable, they have to pay as much as $50,000 to treat that patient, to keep them in the hospital 10 days longer. And so those costs add up. And so if we could reduce the amount of bloodstream infections even by a little bit, we can save hundreds of thousands of dollars for each individual hospital system.